Gestational diabetes. Gestational diabetes is any degree of glucose intolerance with onset during pregnancy. Hyperglycemia develops during pregnancy because of the secretion of placental hormones, which causes insulin resistance. For women who meet one or more of the following criteria, selective screening for diabetes during pregnancy is now being recommended between 24th to 28th weeks of gestation, age 25 years or older than 25 years, or younger and obese. Family history of diabetes in first degree relatives or member of an ethnic or racial group with high prevalence of diabetes. Gestational diabetes occurs in up to 14% of pregnant women and increases their risk for hypertensive disorders during pregnancy. Initial management includes dietary modification and blood glucose monitoring. If hyperglycemia persists, insulin is prescribed. Oral anti-diabetes agents should not be used during pregnancy. Goals for blood glucose levels during pregnancy are 105 mg per deciliter or 5.8 millimole per liter or less before meals, and 120 mg per deciliter or 6.7 millimole per liter or less 2 hours after meals. After delivery of the infant, blood glucose levels in the woman with gestational diabetes return to normal. However, many women who have had gestational diabetes develop type 2 diabetes later in life. Therefore, all women who have had gestational diabetes should be counseled to maintain their ideal body weight and to exercise regularly to reduce their risk for type 2 diabetes. Clinical manifestations. Clinical manifestation of all types of diabetes include the 3 P's: polyuria, polydipsia, and polyphagia. Polyuria, increased urination, and polydipsia, increased thirst, occur as the result of excess loss of fluid associated with osmotic diuresis. The patient also experiences polyphagia, that is increased appetite resulting from the carbolic state induced by insulin deficiency and the breakdown of proteins and fats. Other symptoms include fatigue and weakness, sudden vision changes, tingling or numbness in hands or feet, dry skin, skin lesions or wounds that are slow to heal, and recurrent infections. The onset of type 1 diabetes may also be associated with sudden weight loss or nausea, vomiting, and abdominal pains if decay has developed. Assessment and diagnostic findings. As abnormally high blood glucose levels is the basic criterion for diabetes diagnosis. Fasting plasma glucose level of 126 mg per deciliter or more, or random plasma levels exceeding 200 mg per deciliter on more than one occasion, or diagnostic of diabetes. Plasma glucose value may be 10% to 15% higher than whole blood values, which are obtained with finger sticks. Thank you.